for San Francisco General Hospital for this date of July the 23rd. And I'll ask that the secretary call the roll.
Yes, I'll start with you, Commissioner Chow.
Present.
And Commissioner Green.
Present.
And I will read the land acknowledgement. The San Francisco Health Commission acknowledges that we are on the unceded ancestral homeland of the Ramaytush Ohlone, who are the original inhabitants of the San Francisco Peninsula. As the indigenous stewards of this land, and in accordance with their traditions, the Ramaytush Ohlone have never ceded, lost, nor forgotten their responsibilities as the caretakers of this place, as well as for all peoples who reside in their traditional territory. As guests, we recognize that we benefit from living and working on their traditional homeland. We wish to pay our respects by acknowledging the ancestors, elders, and relatives of the Ramaytush Ohlone community and by affirming their sovereign rights as First Peoples. Commissioner Chow, is it okay if I call the items?
Yes, I was going to ask if you would please call the items. That would make it a lot easier.
Oh, I'm sorry. Okay. Item 2 is the approval of the minutes of the June 25th, 2024 committee meeting.
So the minutes are before us, and a motion for approval is in order.
Move to approve.
And I would second.
And there's only staff in the room, and there's no one who's been given permission to provide remote public comment. So I will do a roll call vote. Commissioner Chow, how do you vote on this item?
Yes.
And Commissioner Green?
Yes.
All right, thank you. We can move on to item 3, the regulatory affairs report.
Good afternoon, Commissioners. Emma Moore, Director of Regulatory Affairs, here to provide the Regulatory Affairs report for the month of July. So in terms of our pending surveys, there are still a handful of well overdue surveys, such as our dialysis survey, which, knock on wood, has been overdue for more than 5 years. I will say we are still waiting for our CDPH CMS complaint validation revisit in acute psychiatry. So I think any day now. We are under the belief that they intended to come the week of the 4th of July, but there was a COVID outbreak in that area, and so they elected to reschedule. So it could be as early as tomorrow. I will also share that the last line on the pending surveys, the CMS 4A recertification, occurred last week. It went exceptionally well, especially when you consider the fact that there were 6 surveyors and at the time 14 patients on the unit. So there was an extreme amount of scrutiny. As well as one of the surveyors present was a dietitian who was with us for 3.5 days and really dove into the kitchen and the dietary services. So overall, that we are waiting for the official report, but exceedingly well. I do not have any concerns for condition level findings or anything at this point, given that. And the mandatory follow-up to that survey was that yesterday we had the 4A fire life safety survey, which always comes immediately after the recertification survey. And there is some construction being done on that unit as part of the seismic upgrade. So there was quite a bit of conversation about that. But overall, the things that they identified were fairly minor and I believe will be addressed expeditiously. Moving down to survey activity, you can see that the DHCS Merck annual audit occurred in June. We are awaiting the final report. Those sometimes can take 6 to 12 months to arrive, so we will be ready for it when it does come. On 6/6, there was an anonymous complaint investigation regarding I see a typo there on the word release. I apologize for that, but release of information to a family member. The surveyor was unable to substantiate the complaint, so we believe there will be a negative 2567, which brings me to my first answer to a question, which is that a negative 2567, bizarrely enough, is a positive thing. So the CMS, when they say it's a 2567 or a positive 2567, that means we're receiving a plan of correction we have to respond to. In the way that they have to have their own terminology for everything, a negative 2567 means that there is no response required. They've either substantiated with no deficiencies or they've been unable to substantiate the issue. So thank you for the question, giving me a chance to clarify it, and that is in fact a positive thing. I will also just mention the second question, or answer to the second question rather, which is we do not explicitly, we track all survey visits, but we do not explicitly track complaint visits. Part of the reason for that is that there's a lower volume of them, I think, in comparison potentially to Laguna Honda, but also because they have the great potential to turn into other things. So for example, and so it kind of morphs over time, and that fact that it started as a complaint is not necessarily as as meaningful. So, for example, the psych revisit that we are now awaiting that involved the condition level findings involving patient rights, which were primarily documentation related, started as two complaints. They did not substantiate either of those complaints, but they found other things while they were there. So I think that's kind of more the nature that historically we certainly do keep a log of every time a surveyor interacts with us, but we have not done that. The other piece of it is that since COVID, much of CDPH's investigations have gone to an email basis where they will send us an email and ask for some information. Officially for complaints, they are supposed to show up in person, but sometimes surveyors take a somewhat fluid approach to that. And then for the facility reported incidents, they also take a fairly kind of laissez-faire attitude, sometimes, depending on the surveyor. So that's kind of the reasoning behind that. To continue down the list, on 6/10, we had an additional CDPH anonymous complaint that was related to staffing. While we do have on here that this investigation is ongoing, in the last couple of weeks, there have been several interviews and things done with staff, and it is our current understanding we anticipate we will receive a negative 2567 for this case, and there will not be anything substantiated. The other big news from June was that the Joint Commission lab survey happened. So this was campus-wide, though primarily focused on laboratory services. There were 9 findings. Overall, they were all in the low, limited, or limited moderate categories, meaning there was no leadership involvement or preventive analysis required, which is an excellent, exceptional feat. So those teams are working on that, and we will be submitting that plan of correction in mid-August. Moving to page 2 to section 3 about plans of correction submitted. We did receive one privacy breach plan of correction that related to unauthorized access to medical information when a senior clerk and union member were included on emails involving PHI. So the OCPA is working through, we've submitted the plan of correction, and they're working through those corrective actions and auditing to make sure this does not continue to be an issue. Moving down to section 4, in terms of CDPH facility reported events, I am sorry to say that I think because I said it out loud so many times, we have, not really, but we have broken our HAPI streak. So there was 1 reported HAPI in June and 2 COVID outbreaks. There will also be several more COVID outbreaks we'll be sharing next month. There has certainly been an uptick. I will say though, for the year, you can see that our year-to-date reported events for the first half of 2024 is at 16, whereas last year we were at 50. And I'd say that that can be directly attributed to that lowered HAPI number. So while we're not at 0 anymore, it is still showing a significant improvement. And lastly, in terms of plan of correction monitoring data, in terms of Joint Commission, we have 36 of 82 findings have successfully completed their 3 months of typically greater than 90% compliance for 3 consecutive months. Worth of data, and more that is shared in more detail as part of the PIPS minutes. And with that, I will open it up for any questions.
There's no public comment on this item.
Thank you, Commissioner Green.
Well, I just think it's wonderful that the 4A survey went so well, and that the TJC achievements of the lab are quite incredible. In a way, it's too bad that we can't give more context to what goes on in other hospitals, because for the complexity of the patients and the volume and the extensive responsibility, it's quite incredible how well you do. And I think it also reflects, I think, that all of these surveying entities obviously have a lot of faith and trust in the leadership and in the way things are done at the county. So thank you.
Right. It looks to me also that the number of key surveys seem to have been accomplished, and we are looking for just a few more to go. But I think that, as Commissioner Green pointed out, it's really a remarkable record. I think if we look back on all the different key surveys that have occurred over the last quarter, that the organization has done as well as it has, and really should be the staff that organizes all of these, and the working staff are really all to be commended. So I think that in the sense of the anonymous complaints, right, I guess the only question I would have is whether or not we should at least look at the volume that has been occurring. I thought we did at one time see that the anonymous, well, not the anonymous, but any complaints actually were fairly small in number compared to, of course, our nursing home facility. But am I wrong that we at one time did track the number of complaints that we were getting?
And I apologize, I don't have that information. I can share that in the last 18 months, that is not something that we've tracked nor that I was handed to my predecessor, but we're happy to look into it.
Okay. If it's been 18 months, perhaps we could get a report as to what the volume was in terms of on an annual basis right now, just to compare that to our sister institution.
Sure, we will include that in next month's report. Thank you for the feedback.
Okay, that would be good. Thank you. Without going through a lot of work on that, just give us sort of the feeling of the volume, as you were saying, that it's
Absolutely.
really quite small. And let us go on to, if there's no other comments, we'll go on to our next item. Thank you.
All right, thank you. Item 4 is the CEO report and Burt newsletter.
Hi, good afternoon, Commissioner Chow, Commissioner Green, Dr. Koufax, Mark Morowitz, Jillian Otway here, Interim Chief Nursing Officer, presenting today on our CEO's behalf, Dr. Susan Ehrlich. So highlights from our June report, I'll start with equity. ZSFG was represented in this year's Pride Parade. Our theme was Beacon of Health. We are very proud that for the second year in a row, ZSFG has been recognized as the LGBTQI plus healthcare quality leader in the Human Rights Campaign's 2024 Healthcare Quality Index. Now, in terms of developing our people, I'm happy to welcome 2 new members to the exec team. Lorraine Pearson is now the Associate Dean of Administration and Finance, UCSF Dean's Office at ZSFG. Lorraine is a decades-long leader at UCSF, including as Director of Administration and Finance for the Department of Medicine at ZSFG, as well as co-chair of the UCSF Committee on the Status of Women, and 2-time UCSF Award winner for exceptional service and for the advancement of women. I know that there was, I believe, a question about Lorraine's role with finance, and I am sure that she will be involved with Dr. Ehrlich, Dr. Critchfield, and Eric Wu, our Chief Financial Officer, in making decisions regarding the affiliation agreement and the allocation of resources. I'm also happy to welcome our newly elected Chief of Staff, Dr. Mary Mercer, Professor in Emergency Medicine. Mary has led many performance improvement efforts in the ED. She is the co-director of ZSFG's Relationship-Centered Communication Program, and she is also the director of the EMS and Disaster Medicine Section and Fellowship at UCSF. She serves as the medical director of Alameda City Fire Department's EMS as well. She has published extensively on these topics, including a recent article on SF's citywide COVID response that is about to be published in the New England Journal of Medicine's Catalyst. We look forward to working with Lorraine and Dr. Mercer as new members of the exec team. I also am very proud as the nursing director for the labor and delivery team. They have recently received 2 recognitions and awards from the California Maternal Quality Care Collaborative, the Superstar Award and the Quality and Sustainability Award. We're very proud of the work that's being done in the birth center and caring for our birthing families. In terms of recognitions, I also want to acknowledge David Lawler, our Director of Materials Management. He was last month's Values in Action Award winner. The award recognizes that the recipient has exhibited joy in their work, thirst in learning, and compassionate care. And of course, We are fortunate to have Dr. Ehrlich at the helm, and we're so proud of her recognition that she received on June 11th by the Board of Supervisors, recognizing her for her leadership at ZSFG, her ability to transform organizations, and her commitment to increasing healthcare access to San Francisco's most vulnerable. I'm going to move on now to our data report. I want to highlight the following on page 7 and 8. Our average daily volume in the ED and admissions from the ED were slightly down, which is what we feel is due to seasonal changes. This is very similar to a pattern that we observed at the end of the summer last year, or during the summer last year. Page 9, left without being seen or triage, continues to be a challenge, and we continue to work on perfecting the triage process, especially given the continued high level of boarding in the ED. Improvements that we are now focusing on involve hiring of nurse practitioners and addressing practices of being able to do medication administration during that process of entry into the ED. Page 10, our ambulance diversion is also continues to be a work in progress. Performance is very dependent on staffing and boarding primarily. We've also experienced with the staffing and the diversion rates a recent COVID outbreak in the ED and in different units throughout the hospital. And so that has impacted us. In terms of page 15, our daily admissions to inpatient psych from PES, that is declining because of ongoing challenges with placement from the inpatient unit. Our main issue at this time is LSAT care, and we're working with BHS on addressing this. Moving on to the 4A SNF on page 23. Our average daily census is intentionally low because of the seismic work occurring on the unit. We're hoping to be able to close the unit entirely by September in order to complete the work in the shortest amount of time and probably under budget if that's at all possible. We currently have also, and I know this was a question that was asked, we do have more custodial patients at this time. And patients are also, since the end of the COVID regulations, being given an option as to whether or not they want to go to 4A as a SNF or would like to go to community SNFs. And so we feel that that is part of the reason why our SNF numbers have dropped. How many patients, I believe, are we expected to need Laguna Honda? I don't know that we know that answer yet. I think that the Laguna Honda team and the generals team are still meeting to talk about the admission guidelines. And as I said, patients will now be able to have that as an option, as a place to go if they choose to. And so we'll have to see what the outcome is. Laguna has committed, though, to us that they will take 30 patients, which is what our census normally would be on that unit. So we'll have to wait and see. On page 24, the medical surgical lower level of care average daily census has changed. We are working to better align all of these graphs with our strategic initiative KPIs. And this is one of the first change. This is a process. And so we expect that you'll probably hear more about this in the coming months. The new line graphs are custodial average days and SNF average days. And the custodial days represents the total average lower level of care days, and the SNF is a discrete category on its own. Moving on to workplace violence on page 27. Workplace violence, physical assaults shows a slow trend downward, especially when you're looking at the total assaults. Dr. Green, I believe that you had said that you remember psych had some of the highest numbers of workplace violence. And we're now seeing that in med surge. And we are seeing these number of assaults with older people that have dementia. And so the team are working to understand what would be the best countermeasure for these types of circumstances. There was another question regarding the NICU and the diversion that we have been seeing recently. It's interesting. I was talking with the team today, and we have 14 to 15 beds that are staffed at any given time. And currently we have 7 of those beds with babies that are withdrawing, and you know the care that entails, which means that they will be with us for some time. And so that's part of the reasons for the high census right now in the NICU. One of the things that we've been working and talking about is if it would be at all possible for some of our more stable babies to be moved to the pediatric unit. And so that may be something that we start to look at and consider in terms of training and competencies. So more to come on that. And then Bert. We do believe that our lower numbers that we're seeing of BERT interactions, encounters are related to the lower census during the off-shift hours in the ED. And I know that that was a question. And this concludes my report. Are there any questions at this time?
And again, there's no public comment.
Thank you. First, I think we want to welcome and congratulate Dr. Mercer for her ascension into the Chief of Staff role. And we look forward to many months of interaction with her. And so congratulations, and we'll be seeing a lot of you. And of course, Dr. Ehrlich isn't here for us to also add our commendation to the cities. We're a much smaller part, but we feel we're much closer to the work that Dr. Ehrlich has done, and certainly she deserves the city recognition. So those were my opening comments, and I'll ask Dr. Green. I know that some of the questions came from her, so if she has any follow-up or any other comments regarding the report from the CEO.
Well, yeah, thank you. Thank you for the presentation. And it's wonderful to formally meet you, Dr. Mercer. And I see Dr. Critchfeld there, who we've missed for a while. It's great to see you too. I thank you for answering all the questions. And as always, we just look so much forward to hearing from your team and seeing this wonderful work you're doing. So thank you so much.
Thank you.
Yes, Dr. Critchfield, congratulations on your new interim appointment. And if you take on any more roles, I don't know how many roles you've had for the hospital, and now for the dean's office. So wonderful, and congratulations also.
Oh, Dr. Chow and Dr. Green, thank you so much. You both have served so admirably. And Dr. Chow, where to begin with the roles you've had over the 4 or 5 plus years of your long esteemed career. So thank you. That means a lot to me. How long in the commission for you, Dr. Chow?
Well, it's over 30 some odd years. And one of the joys is actually having met and being associated with you and your work over all these years. So,
well, since you bring up joy, if I may, I think Dr. Colfax is sitting over there next to Mark. I just had and maybe it was mentioned, I just joined, but we both had the just distinct pleasure of being at the Avon 20th anniversary celebration, and it was just a beautiful event. And then one of the patients who was a client of theirs talked about how she just found it a safe, beautiful place filled with the beautiful people who took gentle, skillful care of her. And it was a wonderful partnership. So hopefully you'll see those photographs from Dr. Colfax. And it was really a wonderful event. So I wanted to interject my joyous moment with you there, Dr. Chow.
thank you. And I think going back also to some of the issue raised concerning the work with Laguna and how you're actually offering SNF patients the opportunity to go to also other facilities. I think it would be appropriate somehow that we kind of get an overview of the work that is being done between our two facilities, and how then the SNF at SF General is going to be looking at triaging, and um, I'm not sure whether, and I'll ask President Green in this case, what would be the best type of presentation, because each of the JCCs are looking at this, but perhaps the commission should really understand what is occurring between the two institutions, and the whole question of SNF and the custodial care level.
And President Green, if you may, Nita has a response, I think, from that side. Could we go there, and then could you weigh in, or would you like to weigh in and then?
I was thinking it would be a great thing to discuss in our leadership team meetings with you and with Director Colfax, because there could be a lot of stakeholders who would want to hear about it. And I think we have to think about the best venue.
Sure. Is it okay if Nita also weighs in, or yes, please jump in. I see you're unmuted.
Yes, and I'm sorry, I think my video is not working, but I'm just about to join the leadership meeting for Laguna Honda, so I will pass on to the leadership there this request, and we can coordinate with all of you on what's the best way to do this, because again, we're so delighted about the partnership, and at the same time balancing, to really ensure that we have the right fit for the residents who are coming over to Laguna Honda, and that they're, ready to accept the folks. So I will take this to my next meeting at 3:30 with that group, so that we can coordinate further.
Thank you.
I wonder if Dr. Colfax also has any thoughts on, at this point, as we're sort of trying to develop an overall presentation on how, as a system, we're coordinating our SNF population.
Yeah, I'm happy to take that back to the team and come back to the Health Commission leadership to figure out what the best structure is for that type of presentation. But certainly we have the information and can provide that information and the data to the Health Commission. So I will loop back with the team and then loop back with the Health Commission leadership and figure out the best next steps.
Great, thank you. Just switching topics, and this is more for my own education. On the June report from Bert, there's a preferred language that I actually, in my ignorance, don't recognize, which is Sango, which seems to be at 16% of the preferred language. So is that coming from a particular group of people that we're happy to see under Bert, or and how do we attribute the language to whatever group speaks this?
That's a great question, Dr. Chow. I will have to take this back. I don't have an answer for you at this time.
Okay, no, that's fine. I think I'm seeing it correctly, and I'm just trying to attribute it, and it could be a certain number of people coming from a area or population.
Yeah, I do see it in the June report, and I am not familiar myself with that. So I will have to ask the BERT leadership, and we can get back to you on email.
Sure. And lastly, just to comment that thank you for the explanation on the skilled nursing decrease in the census, and would like to continue, of course, in our dialogue to look at, as you have already pointed out, the number of custodial patients we still have and what we can continue to do about it. And our at least our diversion rate still, it's below our target. So those are the only comments I have in regards to the report, and thank you for giving it in place of Dr. Earle.
Thank you. Commissioner Chow, if I may jump in, Director Colfax just looked up the language and it seems like it's from the Congo, a language that's spoken in Africa and the Congo. But I'm sure we can still get more information on it, but that was a quick Google search. And yeah, and then
It does seem that if it's coming from there, whether we could get an explanation is there a special group of people that we are now looking at, and it could be really one of these small minorities, and maybe something that we should be doing about them.
sure. And if I may just bring forth what has been said before in meetings that you haven't been in, Commissioner Chow. Both Mr. Pickens and Dr. Ehrlich made it clear that the average stay at the SNF and ZSFG is rather short. And so the plan was for it was going to be a slow process to admit people to Laguna Honda, and that anyone admitted would have to meet SNF qualifications. And I'm saying all this just in case there are other folks who are watching who are concerned about Laguna Honda. We wouldn't want to have questions around that process, but some of that's already been answered. But we certainly will still take your request back and get a more thorough overview in some way.
Right. I do think it's important to continue to follow the guidelines that Laguna has also put in place and is part of our system, which says who are qualified really to get to there, and it's
Right.
for you to reemphasize that. Thank you.
Sure. Is it okay to move on to the next item?
Yes, please.
Okay, great. Item 5 is the hiring and vacancy report.
Good afternoon, Commissioners. It's nice to be here in person. This is Priya Nayar, Laguna Honda HR Operations Manager, covering for ZSFG Emma Perez this month. I begin with the total hospital vacancies, slightly decreased to 6.39 as of June 2024. I do note that there was a clerical error last month. And the May vacancy rate, the accurate rate was 6.42, which means that, we're actually seeing a decrease this month. We've hired a total of 64 employees between June 1st and June 30th in various classifications, including registered nurses, and had 6 separations during the same period, of which 1 was a retirement. The registered nurses vacancy rate remains about the same at 2.3%. To overcome challenges in hiring nurses, we have hired 23 nurses at CSFG in June, and this includes reassignments. We've reduced department-wide vacancy rates from the 9.5% that we saw in January of 2024 to negative 0.21% as of June 2024. I'd like to also call out that our retention rate is strong at 95%, which is up by 5% since the last fiscal year. The planning sessions, RN planning sessions, focus on process enhancements and areas for advancement. The HR and nursing leadership are planning a hiring event in the coming months to take advantage of the increased interest in experienced nurse positions and to fill the new budgeted positions that will become available in August. We are foreseeing this hiring event to take place sometime in September. And with the increased interest, we also foresee that there could be a very good talent pool available from which we could have interested candidates move through the selection process. HR conducts weekly, monthly vacancy meetings with the hospital executive team and program managers to review hiring plans. RN hiring status updates. Emergency care unit, 4.3 full-time employee vacancies, and 4 selections made with target work dates in July, August 3rd and August 17th of 2024. Critical care units, 2.6 FTE vacancies, of which 3 selections have been made with start dates in July and August. Med surgical unit, 7.5 vacancies, 2 selections made with target start work dates in July and August. The OR unit has no vacancies. The RN training updates. Next, emergency care training program. This is the ongoing rolling training program anticipated in August with a cohort of up to 10. Other training programs are being reviewed on a needs basis and just strategically in line with when classes complete and when trainings are needed. So it's basically in review right now. Highlights of ZSFG non-RN hiring. We had one 1823 or a senior administrative analyst join ZSFG last month, one 2454 clinical pharmacist join us, three hospital eligibility workers in the 2903 classification join us, and then three senior hospital eligibility workers in the 2908 classification join us. And we also had 3 medical evaluation assistants in the 2430 classification also join us. That concludes the staffing report, and I'm happy to take any questions.
And there's no public comment.
Thank you. Commissioner Green.
Well, first, congratulations on the excellent staffing. It continues to be such positive reports. I did have a kind of a question, which is, in the past, I know that in daily meetings, the leadership looks at things like overtime and registry use. But, and I understand where it would be awfully hard to find trend lines in that with COVID and with when you aren't fully staffed. But now that you're getting so close to what may be, the best possible situation, would that be something you would find useful? And I know from a cost perspective, at our place, overtime is absolutely crushing the unit I work in. And it's always been due to staffing. But I'm wondering if there'd be any value, if there's any purpose to looking at, I know the unions have been very interested in the whole question of registry use, but you're so close to the finish line here. Is that something that would be part of a report? I know you're trending it day to day, but I was just curious about that.
I can confirm that we do look at it. So we do have monthly reports that look at overtime usage as well as registry usage. We probably haven't brought it up to this session to see if there's interest in seeing those that information and that data. If there is, then I think we should be able to present that as well.
That would be real. I think I know it would never want to put you through extra work, but I know you look at it, and it might be. I'm looking for even more positive information, because I suspect these things are both getting exceptionally better with your good staffing.
You're right on point, Dr. Green, and we do look at that data, and we meet now monthly with the unions to share with them those numbers, and they are trending downward. So as we're hiring, we've seen our registry numbers decrease as well as our overtime. The balancing act that we're doing right now is that all of these individuals are still in training. And so that's where we're kind of in the middle of, the rubber meets the road. We can't actually count some of these individuals in staffing until they have finished their orientation. And so our numbers, I think when I last checked, we had probably 50 to 60 registry in-house at ZSFG. And I can tell you 3 or 4 months ago, we were up to 120, 130. So as the contracts have ended, we have opted not to extend because of the impact that we are seeing now with the hiring. And we're really excited. I know you mentioned the event in September. It's going to be on a Saturday, September 14th. We're probably going to have about 200 applicants come through. They'll do tours, they'll meet with the managers and directors, and then we're committing to interviewing them either Monday, Tuesday, or Wednesday of the following week, so that because of the new positions that we've gotten, we anticipate that these individuals will immediately be able to hire and go into those positions in October, so that we won't have a lag time. because we want to really continue with the momentum we have currently with the processes that are in place that are working so well for us. The city has also become a place of uh, a really positive place of hiring. And this is something that I had not even experienced years ago when I was doing hiring and recruiting. We normally in the past would always depend on new graduates because that was our, for most part, our bread and butter. And now we're seeing a lot of experienced labor and delivery nurses. We're seeing a lot of ED experienced nurses and critical care nurses that used to work registry but aren't getting those lucrative contracts any longer now that COVID is over, and they are taking a position at the hospital. And when I've spoken to them personally, because I manage the registry as well, what they've said to me is that they feel that ZSFG is probably one of the best run hospitals that they have worked at in the country. And again, these are nurses that are registry nurses that have traveled around the country. And we're really excited and proud of that.
Well, that is no surprise. And that is really great news. How much of this information, I was just thinking about that complaint also about staffing that we heard in the Regulatory Affairs report. How much of this really do you think filters down to the rank and file staff? Because your numbers are incredible, the fall in registry, nursing use and so forth. I mean, so many people want to be reassured that you have ample staffing, and obviously emergencies happen and things change. It's tough to staff some of these units, but I'm curious to know whether this really positive information is getting out to the people, in the trenches.
Well, they are engaged with orienting and precepting all of these new staff members. So they definitely know and feel it from that end. And interesting that I met with the surveyor to talk about the staffing complaint. And one of the things that she mentioned was that when they interviewed staff, staff said things have gotten much better. So, and I was very honest with her. I said, a year ago, definitely we had issues. I said, but I can tell you now that things have changed dramatically. And she said, yes, we've also heard that from the staff. One of the other things that I mentioned to her as well is that our ratios are a lot richer than the state ratios, because the MOU states that we're 1-4, 1-3 in med surg, for example, whereas the state ratio is 1-5. And so that was something that she was not aware of. And she was a little shocked that a hospital would do that. And I said, no. So we are within ratios. And again, she felt that, she had gotten the information that she had needed to make a decision that things had changed for the better. So.
Well, thank you. I mean, that's great news, and I appreciate it. I figured with you here in particular, this would be an opportune meeting to raise the question. So thank you very much.
Thank you.
Yeah, I also believe it's phenomenal that you're now at a minus 0.21% for your nursing vacancies. I'm sure, well, even a year ago, we never thought we would quite get to that point. So, and I think the new graphs that we have really demonstrate very well the vacancy rate trends, and really want to congratulate everybody for taking the opportunities that the city has given us, and you also influencing the city on how we can do hiring a lot better. So thank you very much.
It's okay to move on to the next item, Commissioner?
Yes, please.
All right. Thank you again. Item 6 is the medical staff report.
Good afternoon, Commissioners. Thank you so much for the warm welcome, Commissioner Chow and President Green, and greetings to everyone else who's in the room. My name is Mary Mercer. I'm the new Chief of Staff, as was mentioned earlier, and it's my pleasure to present our medical staff report for this past month. The first order of business was the neurosurgery service report, which was included in your packet. And I'll just point it to a couple of highlights from that very extensive report, but really at a high level, just mentioning what a really great celebration of the outstanding partnership that we have had from ZSFG and the university for so many, over a century and a half. That this is an example of all of the ways that clinical expertise that really is for San Francisco as a community, and in innovations that are made on behalf of our citizens and through our Department of Public Health, really are able to spread and serve other people in the Bay Area, as well as for the expertise to be spread nationally. So you'll see that through the very productive and very busy neurotrauma, neurosurgery services. They cover both trauma-related issues and non-trauma related issues, and cover over $100 million of research grants that help to improve our delivery of patient care within the safety net and across San Francisco. A couple of innovations that they are most proud of recently, including their ongoing recognition as a leading neurotrauma center recognized by the Joint Commission. They have recently added some trials of minimally invasive spine surgeries, which both is an excellent innovation that really brings the standard of care for spinal surgery to our patients, but also offers some opportunities for contributing to the decreased length of stay. So you could even see within that report how all of our services are really working together to both provide excellent patient care and high quality care, as well as to address system-wide challenges and ensure efficient and equitable care for our patients. Another piece that I wanted to highlight was, through the expertise that really has been developed at the San Francisco General through their treatment of traumatic brain injury, a part of their clinical staff now having had many years of fellows that they've trained through the Department of Neurosurgery and at ZSFG. A number of those staff are now staffing hospitals around the Bay Area and providing much needed brain trauma, neuro trauma services. Which is down in the South Bay, although this is not related to San Francisco per se. It's just to note that our expertise has really helped to ensure access for critical trauma services in the East Bay.
Dr. Mercer, you've frozen, just for you to know. Not sure if you're able to.
These are helping to ensure high quality of care through the Bay Area.
Dr. Mercer,
yes.
I'm sorry to interrupt you.
Okay.
You're freezing a little bit, so I'm wondering if you could turn off your camera to maybe
Sure.
save the
I'll turn
bandwidth.
off. Yep.
Thank
There
you.
we go. Thank you. And then finally, I also wanted to just highlight the collaborations through this service with, they currently are in a search for an additional faculty member and are making sure that they're going to select someone who is mission aligned with the mission of ZSFG, and in ensuring that they'll have a high quality candidate who is also committed to our dual goals of quality and equity. And so that search is continuing. And they rely on a broad range of collaborations with all of our other services in the hospital, the medical staff services, as well as a range of very accomplished advanced practice providers. So all in all, a very successful medical staff report and update. I can take questions for that before moving on to the privileges update, which were for two services.
Commissioner Green, any questions on the presentation on the neurosurgery service?
Well, thank you. This is a truly remarkable department. And I learned a lot just reading this report. I had no idea there were blood-based biomarkers that could help determine whether people needed, CT or not. And I also loved these. It seems like each presentation we get from the departments with their slides are more and more well done with wonderful pictures. And, we got a little bit of a flavor for this when Ms. Lay got that award at the medical staff meeting, and all the nice things they said, which really did reflect the quality of the department in general. So I very much appreciate all that they're doing. And obviously everyone knows it's in TBI, it's a national leader. So I had no questions other than that, except 78 hours of call a week.
Yes.
Was that a misprint?
No, it's believable based on all that they're doing. So they're eager to hire that additional faculty member, but we were all wondering how they stay human. But they're pretty incredible.
I started doing the math. That's a lot of hours. So
Yes.
they definitely need help.
Yes.
Thank you.
All right. Thank you. So the other two items, in addition to
No,
approving.
I
Oh,
did
go ahead.
have one
Sorry.
question,
Oh, go ahead.
Dr. Mercer.
Sure.
And thank you again for the PowerPoint slides too, because they really add to the depth of understanding of each of these departments, and particularly the neurosurgery department that is so outstanding. On the acute care network that they actually presented in terms of showing that Highland and Washington and Queen of the Valley
Yes.
we're now adopting this. What about the main Parnassus campus?
I think that's a wonderful question that we could definitely bring to our UCSF Health colleagues. But I'm happy to bring that back to Dr. Manley.
Okay. And I note that Dr. Manley says that he's only a half-time FTE.
He was referring on that slide to the clinical care provided. So and as might have alluded to, based on the 78 hours on average of call per FTE, he kind of says numbers are a little bit fungible in neurosurgery, but he's the PI on a number of grants which have reduced his clinical time, and that's why they have additional volunteer faculty that bring them up to near whole, and they're looking to hire another full-time faculty.
Surely. No, thank you.
Mm-hmm.
I would appreciate
Yes.
understanding that there is a relationship with the main campus too.
Absolutely. Thank you, Commissioner.
Thank you. Please proceed.
Okay, wonderful. The other items, there were some administrative changes in the neurosurgery rules and regs, and those were approved. And then the other two privileges updates that were made for the pediatrics privilege and for the family and community medicine privileges were around the practice of circumcision. And this was discovered as we realized that there were a limited number of providers in OBGYN and in urology that could provide those services, and only one neonatal ICU pediatrician who had dual privileges for these services. And so they wanted to expand training and privileges for circumcision to make sure that the care was being provided in a timely fashion to our patients and families when that service was requested. And we realized that family and community medicine also needed this additional privilege added and updated so that the requirements were the same between the two services. Any questions about those changes?
I had none. Commissioner Green, did you have any questions on the privileges?
And the only question I had in the family medicine is that they're privileged for vacuum deliveries and actually to be primary surgeon on a C-section, but I didn't see forceps mentioned.
Yes,
and
I received that question, and I wasn't sure if you were referring to this open one or for later, but I can address that answer right now if you'd like, President Green.
Sure, certainly.
The family, if you note, they must be supervised for vacuum deliveries by OB-GYN. And so now I reached out to the chiefs of service for both OB-GYN and family and community medicine. And now there is kind of declining because vacuum has become much more commonly used in a number of training institutions, my understanding, and especially within family and community medicine. That is all that they have privileges to do. If the OB-GYN consultant feels that it must progress to a forceps delivery, then that would be performed by the OB-GYN provider.
Great. Well, thank you for looking into that. I appreciate that. Thank you.
Thank you.
So I had no other questions. So are we ready for the action?
Yes, please.
A move to approve the rules and regulations for the neurosurgery department and the family medicine and the added circumcision privileges.
Okay, and I would second that.
Right, and the vote is to recommend that the full commission approve these at the next meeting. And how do you vote on this issue, Commissioner Chow
Yes.
and Commissioner Green?
Yes.
All right, thank you very much. Thanks, Dr. Mercer. And is it okay to
Thank
move
you.
on to the next item, Commissioner Chow?
Yes, please.
Item 7 is other business. Hearing none. Item 8 is public comment. There's none in the room, and we have none remotely. So item 9 is a consideration for closed session.
I would make a motion to go into closed session.
And I would second that.
Commissioner Chow, how do you vote on this item?
Yes.
And Commissioner Green?
Yes.
Great. Could someone please close the back door? Thank you so much. And give me 30 seconds to take us over. Members of the public, you will not see or hear us while we're in the closed session, but we will be back after business is completed. Back in open session. Commissioners, please consider a motion to disclose or not disclose discussions held in closed session.
Move not to disclose.
I would second that.
And Commissioner Chow, how do you vote on this item?
Yes.
And Commissioner Green?
Yes.
And then finally, consideration for adjournment.
Move to adjourn.
I would second that.
How do you vote on this, Commissioner Green?
Yes.
And Commissioner Chow?
Yes.
All right, thank you, everyone. I'm going to close out the meeting in about 10 seconds.
Okay, thank you, everybody.